This is Courtney Babb, and I'm going to be talking about the title page of our presentation. It will be discussing nursing dashboards with a specific focus on pressure ulcers, and it will be presented by Ashley Babb, Courtney Babb, Baylor Luck, and McKinley Moore.
This is McKinley Moore, and I'm going to be talking about overview of quality safety measures in organizations, pressure ulcers. Establish the purpose of the presentation, including the interpretation of data from this dashboard. The purpose of presentation is to display quality indicators from a nurse-sensitive dashboard with a focus on percentage of occurrence related to pressure ulcers. Interpretation of the data reveals 4 measured quarters with a target goal and actual achievements. The variance from the listed goal is also noted. The dashboard describes the time period description, target goals, actual results, and a variance tab for comparing data about pressure ulcers. This allows for visual comparison of data from each quarter on the dashboard and evaluates if the mentioned goal for preventing pressure ulcers was met or not.
This is Baylor Luck, and I'm going to be talking about the overview of quality safety measures in organizations, pressure ulcers. A quality dashboard is multiple sources, data extracted and analyzed, and understandable. From Frith, Anderson, and Sewell. A nursing services dashboard can provide information to guide staffing decisions for positive outcomes. Frith et al. Properly designed dashboards should contain data from multiple sources using standard definitions, have the capability to mine data and extract them for statistical analysis, and be presented to users in understandable ways for decision-making. Frith et al. A dashboard provides graphic representations of data in real time that can assist the nurse leader to make staffing decisions, monitor productivity, and track the effects of staffing decisions, monitor productivity, and track the effects of staffing on patient outcomes. Frith et al. A quality indicator is used to measure the quality of clinical care. Frith et al. Quality indicators are a balanced suite of quality indicators should include both clinical outcome and process measures. Collins, 2015. Dashboards at the organizational level, a communication tool throughout organizations. Frith et al. The dashboard should be organizationally relevant, evidence-based, comprehensive in its considerations, nurse-sensitive, utilize available data, have comparative external benchmarks, and opportunities for improvement. Doles and Keenan, 2009. Dashboards on the unit encourage nurses to implement change that research data suggests. Doles and Keenan. The dashboard enables monthly comparison of unit performance to external benchmarks and internal goals, as well as comparison to units across the organization. Doles and Keenan, 2009. Data collection accrued from various origins. Frith et al. To assess staffing and patient outcomes, data related to staffing, nurses, units, hospitals, and patients are needed. The origins of the data may vary. For example, data may be embedded in discharge abstracts, incidence reports, patient records, International Classification of Disease, 9th Revision codes, diagnosis-related group codes, charge masters, payroll system reports, financial management systems, quality improvement systems, and patient acuity systems. Frith et al., 2010, page 10.
This is McKinley Moore, and I will be talking about the individual indicator. The dashboard section for pressure ulcers analyzes the data for each quarter measured and overall research. The dashboard included the amount of pressure ulcers in each quarter and compared this number to the goal set by the hospital. The amount of pressure ulcers is measured so staff can determine if the methods being used to prevent them are effective. Also, if the amount of pressure ulcers is less than or equal to the goal, this will be an encouragement to the staff and make them more likely to continue or improve prevention measures in the future. Amount of pressure ulcers in each quarter versus the goal overall. The target was 2.84 pressure ulcers in one quarter. Goals were only met one time in 4 quarters. Overall, the goal was not met 75% of the allotted time. Why are we measuring this indicator? Pressure ulcers affect the patient's health in physical, psychic, and emotional aspects, cause concern among the family members regarding the consequences that these lesions may have on the affected individual, and incur a high financial cost to the institution which invests in products for treatment. Becerra de Medeiros et al., 2017, page 2701. The nurse role is to educate about the amount of ulcers, inform and encourage staff, interventions such as pressure-reducing mattresses, inform of the benefits of preventing ulcers and effects of the ulcers.
This is Ashley Babb, and I'll be talking about individual indicator continued. Why are we measuring this indicator? We are measuring this indicator because PUs represent a problem for hospital and public health institutions. They incur financial costs to health services, as for example with industrialized dressings. They also indicate the quality of health care regarding patient safety, since low PU rates are related to good care provided. The existence of PUs has repercussions on stressful situations for health professionals, specifically for the nursing team. Becerra de Medeiros et al., 2017, page 2701. In Brazil, at the General ICU, 100% of patients participated in the study. 3, a prevalence of 60%, had PUs, and 40% had no lesions. This provides evidence to support why this indicator should be addressed, as evidence collected from a study in Brazil shows that preventing pressure ulcers is a priority, as patients were found with a pressure ulcer more often than a patient was found without one. Becerra de Medeiros et al., 2017.
This is Courtney Babb, and I'm going to be talking about individual indicator continued. Are CMS measures and reimbursement an issue? Why? The CMS denies hospitals higher payment for any hospital-acquired condition resulting from or complicated by the occurrence of certain never events. The CMS believes that never events will strengthen incentives by hospitals to develop safety practices and reduce healthcare costs in the long term. According to Potter et al., 2017, on page 378, many of the hospital-acquired conditions, such as falls or stage 3 pressure ulcers, are nurse-sensitive indicators, meaning that a nurse directly affects their development. Therefore, CMS measures and reimbursement are an issue.
Hi, I'm Baylor Luck, and I'm going to be talking about addressing the deficits. First off, we have 5 evidence-based best practice interventions, and those are reducing length of hospital stay, adding more nursing staff, requiring more delegation to nursing assistants, increasing frequency of patient repositioning, and increasing skin check frequency. And those all came from the Becerra de Medeiros article. According to the figure 3 of the present study, at least one patient hospitalized from 16 to 30 days did not present PUs, but no patient in the group of 31 to 45 days remained without injury. Thus, it can be said that a long hospitalization time is a risk factor for the development of PUs, from Becerra de Medeiros. The existence of PUs has repercussions on stressful situations for healthcare professionals, specifically for the nursing team, as they are responsible for daily dressings and preventative measures to maintain the patient's skin integrity. All this responsibility, besides other activities such as drug administration and bathing in the bed, causes an excess of work for this team and can represent a factor that contributes to the formation of the lesions, from Becerra de Medeiros. Next, we are going to be talking about how can each address the performance measure. First off, it can cause a decrease in the amount of time a patient can develop a pressure ulcer. It increases occurrence of skin checks, lessens the load on the nurses, decreases pressure on one area, reduces skin deterioration, and this all came from the Loy article. Preventative actions are labor-intensive and consume large amounts of clinical time due to the assessment risk, obtaining equipment, patient repositioning, skin checks, and maintaining comprehensive documentation. From Loy, 2017. And now we're going to be talking about U.S. standardized protocols. Every patient is at risk for pressure ulcers. Knowing that is one of the standardized protocols. Also, daily assessments of skin are necessary, and correct documentation with pictures of wounds are required. This is from the Brennan Leiter 2004 article. Acknowledge that every patient with limited mobility is at risk for developing a sacral ischial, trochanteric, or heel ulcer. Daily assessment of the skin, particularly around the at-risk areas, including ischial, sacral, trochanteric, and heel areas, objective measures of every wound by photography, at a minimum weekly, and thorough documentation of the wound's progress with a graph recording in the wound area, depth and region, and degree of undermining. And that was from the Brim and Leiter article.
This is McKinley Moore, and I'm going to be talking about the role of the BSN nurse in leadership skills. I am also going to be discussing the role of the BSN prepared nurse in facilitating this change with some recommendation on how change could occur. Addressing change could involve interventions such as education of other nurses on new equipment, such as pressure relieving mattresses, instructing nursing personnel about appropriate methods of transferring and bathing clients, implementing new protocols via evidence-based practice. These protocols include transferring to prevent shear and reduce friction as much as possible via draw sheets, bathing, appropriately dry crevices to prevent pressure ulcers, equipment, cushions and mattresses, nursing measures, turning more often, cream on red areas, skin assessments more frequently.
This is Ashley Babb, and I'll be talking about role of the BSN nurse in leadership skills continued. Discuss the role of the RN in monitoring the impact of change and how information technology could be used for data collection. When expected outcomes are not met, evaluation reveals the need to continue current therapies for a longer period, revise approaches to care, or introduce new therapies. Potter et al., 2017, page 286. Information technology, IT, refers to the management and processing of information, generally with the assistance of computers. Potter et al., 2017, page 367. Over the past decade, the size and complexity of healthcare databases have grown as significant advancements in data capture and information technology have taken place. Berger and Berger, 2004, page 130. Nursing plays an important role in the prevention and treatment of PUs. The role of the RN in monitoring the impact of change. An RN must process new information and implement it into their practice. An RN also must take specific action to certain changes like vital signs, change in care plans, etc. The RN needs to be an advocate for their patient or they won't want to implement changes that aid their patient. Information technology could be used for data collection as traditional methods for data analysis become impractical when working with very large data sets. This is Ashley Babb, and I'm going to be discussing informatics and nursing. Discuss the role of informatics and the implication in patient care and outcomes. The role of informatics in patient care and outcomes is to improve the effectiveness of nursing care, enhance safety, and improve patient outcomes. According to Hebda and Czar, 2013, page 6, as cited in Potter et al., 2017, on page 368, nursing informatics is broadly defined as the use of information and computer technology to support all aspects of nursing practice, including direct delivery of care, administration, education, and research. How can informatics be used? Informatics can be used to result in an efficient and effective nursing information system that facilitates the integration of data, information, and knowledge to support patients, nurses, and other providers in decision-making in all roles and settings. According to Hebda and Czar, 2013, page 6, as cited in Potter et al., 2017, on page 368, informatics nurses have advanced preparation in information management and demonstrate proficiency with informatics to support all areas of nursing practice, including quality improvement, research, project management, and system design.
This is Courtney Babb, and I'm going to be talking about informatics and nursing. How is data mining relevant to this topic? Data mining is relevant because it can analyze massive amounts of data and provide useful and interesting information about patterns and relationships that exist within the data that might otherwise be missed. As domain experts, nursing researchers are in ideal positions to use this proven technology to transform the information that is available in existing data repositories into useful and understandable knowledge to guide nursing practice for active interdisciplinary collaboration and research. That was from the Berger et Berger 2004 article on page 2. Data mining is relevant to this topic because properly designed dashboards should contain data from multiple sources using standardized definitions, have the capability to mine data and extract them for statistical analysis, and be presented to users in understandable ways for decision making. In your scenario, what recommendations for the use of informatics would you make? The use and documentation of a systematic approach to monitor progress of an actual pressure ulcer leads to better decision-making and optimum outcomes, according to Potter et al., 2017, page 1205. Recommendations for the use of informatics could include, for different pressure ulcers, we could research different methods of wound healing for each specific patient. We can have an alert system for when it is time to reposition specific patients. And we can also look at studies performed by other hospitals to see what certain interventions work better.
This is Baylor Luck, and now we're going to be talking about the summary and main points. What is the role of performance measures? The role of performance measures is determined by what an institution does and how well it does it. Potter et al. Performance measurement is a core administrative function and an essential component of organizational quality programs. Performance measurement quantifies performance in relation to established goals, standards, and expectations, and guides improvement initiatives. Van Fossen, Jones, and Yoder, 2016, page 124. Why is observing for performance deficit important? Observing for performance deficit is important because understanding where faults occur and how leads to better performance of the right actions regarding patient safety and decreasing the occurrence of pressure ulcers. Performance measures are now an integral component of value-based purchasing and transparency initiatives. Van Fossen et al. If this is observed, an organization can implement performance improvement. Potter et al. In performance improvements, an organization analyzes and evaluates current performance and uses the results to develop focused improvement actions. Potter et al. As cited by Potter et al. On page 27, PI activities are typically clinical projects conceived in response to identified clinical problems and designed to use research findings to improve clinical practice. Milanek and Fineout Overholt, 2014.
This is McKinley Moore, and I'm going to be talking about the summary, main points continued. How could using best practices improve the deficit? Using best practices could improve the deficit by preventing the deficit from happening or causing it to happen less frequently. It can decrease the amount of time in the hospital, thus preventing the chance of a PU. Nurses need to increase the occurrence of skin checks, which lessens their load and reduces skin deterioration. What is the financial implication for hospitals? The financial implication for hospitals would be to treat and prevent pressure ulcers in the most cost-efficient and safest way, thus following after facilities that have success in these areas. Nurse executives need to be sure that the data used to calculate the cost per patient day or cost per case are appropriate and consistent with data used in benchmark facilities. The best use of these data may be in organizations within a system who have comparable accounting and financial systems. Frith et al., 2010, page 13.
This is Courtney Babb, and I'm going to be talking about the references page of our presentation. This includes citations from the Potter and Perry book and articles about nursing dashboards, data mining, clinical indicators, and pressure ulcers.